Good evening. Welcome. We're glad you're here. My name's Kimber Perfect. I work for Mayor Ginther, and I just wanted to tell you that the lights accidentally were turned off, so we're just waiting for them to come back up because all of the cameras in this room were calibrated for you to have lights on in this room. So it'll be just a few more minutes. Thank you for your patience.
That's it.
Ladies and gentlemen, our program is about to begin. Please rise for the posting of the colors and the Pledge of Allegiance.
Color guard, halt. Right, face. Present, colors.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. Good evening, everyone, and welcome to the J. Ashburn Center this evening. I don't know if the mayor is here yet, but welcome Mayor Ginther, department directors, along with city council members, our community leaders, staff members, neighborhood activists, and all interested parties here from the community tonight. Is he here? All right. Hello, Mayor. I am Bill Huffman, Operations Manager for the Friends of the Hilltop. I've been a lifelong resident of the West Side. Tonight, we are assembled here in this great facility to hear the State of the City address and what our mayor is bringing to the community in accordance with his previous State of the City programs delivered. Tonight's discussion will address some issues of CelebrateOne and the pre-K plan for education of our children. I am anxious to hear the mayor's plan for this great Hilltop in our beloved city of Columbus, coupled along with discussion from the panel on topics that are of concern to the residents here on the West Side and throughout the city of Columbus. As I look around the room, I recognize faces, and I am humbled and honored to be here this evening to introduce one of our fine community faith leaders. It is my pleasure to introduce to you this evening Bishop Herman Ware of the Oakley Full Baptist Church. Can I have a hearty applause for Mr. Bishop Herman Ware, please?
I'll keep the jokes going by saying this prayer won't take very long. Let us pray. God, we thank you for this day. We thank you for being able to come out and talk. We become a nation that doesn't talk, which means we're a nation that doesn't listen. So we thank you, Lord, for the leadership of our mayor over this beloved city. We thank you for our city councilmen, Lord God, and we thank you for our panelists on tonight. We thank you that we've come with open minds and receptive hearts, that as we talk, we would also listen. God, enable us to not just talk, but act upon the words that are said on tonight. From the mayor's office to the panelists to our community members. And God, we love you on tonight. In Jesus' name we pray, amen.
Good evening. And welcome to the Ashburn Jr. Boys and Girls Club. My name is Naima Green, and I am a freshman at Afrocentric High School. I am a member of the soccer, bowling, basketball, and softball team, as well as an honor roll student. I am participating in the Columbus State College Plus program, where I will earn my associate's degree by the time I graduate from high school. Thank you. But what I am most proud of is my participation with the Boys and Girls Clubs of Columbus. I have been a member at the Boys and Girls Clubs for 10 years. Last night, I was named 2018 Youth of the Year for the Boys and Girls Clubs of Columbus. And I will have the opportunity to represent our community over the next year. The club has played a big role in my life and my success, and it is a place for youth like me to call home. I am very excited about the opportunity to introduce Mayor Ginther because I know he is committed to the city of Columbus and our neighborhoods. It is now my pleasure to introduce Mayor Andrew J. Ginther.
Great job. Great job. Thank you. I don't know about you, but I think Naima is pretty impressive. And congratulations, Naima was just named the 2018 Youth of the Year. Naima, thank you. And is Naima's family here? Any family or friends of Naima's here? Let's give them a round of applause. So good evening, and welcome to the J. Ashburn Jr. Boys and Girls Club for the second State of Columbus Neighborhood Conversation. Thanks to the West High School ROTC for posting of the colors. Thanks to Bill Huffman for the welcome to Hilltop, USA. And thanks to Bishop Ware for his invocation. I'd like to take a moment to thank our elected officials who have joined us here tonight. From Columbus City Council, we have President Shannon Hardin, Pro Tem Michael Stenziano, Councilmember Elizabeth Brown, Mitch Brown, Emmanuel Remy, and Councilmember Priscilla Tyson. Please give them a round of applause. We also have our new city auditor, Megan Kilgore, and State Senator Charlita Tavares. Please give them a round of applause. And now the most dangerous part of the night. Are there any other elected officials in the room that I have missed that I should acknowledge? I'd like to thank our friends at the Boys and Girls Club for hosting us tonight. They are one of the great assets of pride and community here on the Hilltop. I'd also like to thank my cabinet and my staff for putting together a different approach to the traditional State of the City address. I would specifically like to thank our director of CelebrateOne, Erica Clark-Jones, and our new health commissioner, who was just named a few months ago, Dr. Mishika Roberts. And I'd like to thank each of you for coming out, and all of those that are joining us via live stream this evening. So in last year's State of the City address, I laid out ambitious plans for our city to have a tangible, long-lasting impact on the lives of all of our residents. We set clear goals to ensure that every family in every neighborhood is sharing in the success that is Columbus. This was not a one-year agenda, but a multi-year plan. And this plan cannot be accomplished without our community partners. I'm excited to launch the second of our 5 topic-specific neighborhood conversations that will allow us to have a more meaningful discussion about our collective priorities. We will discuss what is working well and explore where there are opportunities for us to do even more together. Tonight, we will focus on CelebrateOne, public health, and the opiate addiction crisis, because each of these topics play a role in helping us build a vibrant, strong neighborhoods throughout our city and create a city where every person, where they have the opportunity to succeed. While there is much to be done, we've had some early wins getting us closer to reaching our goal of getting more babies to their first birthdays and beyond. Because of this community's effort, we have reduced sleep-related deaths by 50% since last year. 50%. That is the lowest number of sleep-related deaths in this community in 15 years because of our collective work. And we can credit this success to the work of all of our CelebrateOne partners, the 625 neighbors that signed up to be Safe Sleep ambassadors. A new Safe Sleep campaign reminding parents of the ABCs of safe sleep: alone, on their back, and in a crib, every nap, every time. Our great hospital partners promoting this campaign to new parents while they're still celebrating the birth of their new child. 1,200 cribs were distributed, and more than 2,000 sleep sacks for babies have been given out. We've increased the number of prenatal appointments for pregnant women by 39% through the great work of our Step 1 program. We know that prenatal care reduces the risk of pregnancy complications and helps identify potential risks to the baby and to the mother. Ask Francesca Naranjo about prenatal care. Francesca is a graduate of the CelebrateOne Connector Corps program. She now works at Step 1, scheduling prenatal visits and following up with expectant moms. Francesca knows firsthand about prenatal care. With her first pregnancy, she had serious complications that led to her giving birth 2 months early. But regular care and a solid support system helped her and her daughter, now 4, manage the preterm birth. That's the story Francesca tells the moms-to-be that she schedules appointments for and that she works with. She also tells them that she gave birth to a second child just a few months ago, carrying him to full term. Francesca is here with us tonight. Will you stand and be recognized? Thank you. Thank you, Francesca, for what you do in this community every day. So we continue to build momentum with a significant financial investment from our community, from across the community. We received an almost $1 million grant from the Ohio Housing Finance Agency to help homeless women find stable housing during their pregnancy. A few weeks ago, we were notified of a $3.3 million grant in state funding to help continue to expand our CelebrateOne work. Corporations and foundations have stepped up too, including our earliest adopter, United Health Foundation, with $1.7 million that started our work with our community health connectors. The Crane Group, together with the members of the Crane family, the Crane Family Foundation, recently announced a $700,000 investment in CelebrateOne to go to the Community Connector Corps program and to its partner, our partner in this incredible work, Moms2Be. We've also had significant individual contributions too. Rod Swain, can you stand up, please? So Rod works at City Year Columbus. He recruits young adults to work with youth in some of our most challenged neighborhoods because he knows the importance of education in breaking barriers to poverty. So in October, Rod had the opportunity to fulfill a lifelong dream of competing on Jeopardy. He decided that whatever he won, he would give to CelebrateOne. In his letter, he wrote, "Ever since I first learned about the infant mortality problem here in Columbus, it disturbed me very much personally. I hope this donation will help, and I'm only sorry that it couldn't be more." Thank you, Rod, for being an example of how everyone has a role to play. I say it often, not any one of us can do everything, but all of us have a role to play in moving our community forward. I'd also like to give a shout out to almost all women. We did have one man who joined our Community Connector Corps just recently. Will you please stand up so we can recognize this Community Connector Corps? These amazing neighbors of ours are our boots on the ground in neighborhoods across the city, connecting moms-to-be with services that they might not otherwise have been aware of. And I know they go through extensive training to do this work well. We are grateful to all of you. Your work is making a difference in the lives of children and families in this community. We still have a long way to go. But Francesca, Rob, all of our Community Corps graduates, these are our neighbors doing extraordinary things to help our babies make it to their first birthdays and thrive in their earliest years of life. The Department of Public Health does some pretty extraordinary things as well. Much of the department's work coincides with the work being done by CelebrateOne. The Women's Health and Wellness Center reached more women, partners, and teens than ever before with a variety of options for birth control and pregnancy screening, including a pilot program with Columbus City Schools. Of course, public health does much more. Just last year, we administered 30,000 immunizations to protect residents in Columbus from vaccine-preventable diseases. Over 3,000 of these vaccinations were administered during 99 different community-based clinics. We licensed more than 7,700 restaurants. We conducted 640 school safety inspections. Columbus Public Health has also been instrumental in our fight against opioid addiction. We know that the addiction crisis is hitting our community particularly hard. And we know that the Hilltop neighborhood has been suffering greatly from its effects. Last week at our neighborhood conversation, many there tied the drug trade to violence and the deterioration of our neighborhoods. The ravages of the opioid crisis reaches all corners of our city, from families to schools to businesses. Last summer, we released the Opioid Action Plan, are now in the process of implementing it under the great leadership of our city attorney, Zach Klein. It includes multi-agency programs to prevent opiate abuse and addiction, reduce the number of opiate-related deaths, expand access for treatment, and improve the safety of our community. We need partners in all of this important work. And tonight, you'll hear from people and organizations who who are helping us reach our goals. Before I introduce our panelists, let me tell you a little bit about how this evening will work. For the next 30 minutes or so, I'm going to ask the panel some questions, and then it's your turn. You should all have a card on your seat. If you have a question, fill out the card. We'll gather the questions and get to as many of them as we can. And if you're watching from home, please post a question online, and we'll try to get to as many questions as we can. We probably won't get to every one of them, but if you include your contact information, email, phone number, we will make sure to follow up with you to get you good information. Now, let me introduce you to our outstanding panel this evening. Dr. Laura S.B. Bell, the Emergency Medicine Physician and Medical Director of Community Partnerships at Grant Medical Center, Ohio Health. Dr. Pat Gabby, the founder of Moms to Be. Sean Holt, CEO of Maryhaven. Jay McAllister, Chair of the Greater Hilltop Area Commission. Al Oboyawana, District Executive Director of YMCA. And Dr. Dana Valangian, CEO, Lower Lights Christian Health Center. Let's get started. So Al, I'll put you on the hot seat right off the bat. The Y is a community organization that's been involved in creating healthy communities for years. What does a healthy Columbus, neighborhood look like to you from the Y's perspective?
No, perfect. Thank you for that question, Mayor, and thank you everybody for attending. I think to me and through my work at the Y, it looks like active and engaged adults, obviously safe neighborhoods, youth that have the opportunity to reach their full potential. I think that's very important. We often at the Y talk about there are no at-risk kids. Every kid is a child of promise, and I think we have to do that, as well as community partners and leaders working together.
I think, Sean, from your standpoint at Maryhaven, and where you sit in the work that you do in neighborhoods throughout this community, give us your take. How do you define a healthy community? What's that look like to you?
Well, thank you, Mayor. Healthy community to me and us at Maryhaven, unfortunately, there's still a great deal of stigma related to the opiate epidemic. And I think there's a lot of people in our community who continue to hurt and are ashamed to get treatment. Mm-hmm. Last year, we provided services to over 11,000 people. 80% of those people were addicted to opiates. Mm-hmm. And so a healthy community to us looks like reducing the stigma that's related to getting treatment and feeling like we live in a community where people do care and we're not going to give up on you.
Jay is a West Side community and neighborhood leader who is so involved in so many different things that take place. What else can you add to this? What are your neighbors and the folks that you work with and represent? How do they define a healthy community? What else can we be doing as a community to address health and wellness on the West Side?
I believe that they all want a safe home, someplace where they can raise their kids without being in fear. They want a clean neighborhood. They want it to be crime-free, and a lot of that relates right back to the opioid epidemic, because that's what takes away from a good deal of that.
So, Dr. Dana, for those of you, there may be some folks here tonight. I was lucky enough to do a tour and spend some time with you last year and to find out more about what Lower Lights Christian Health Center is doing and what you're doing to improve the health of patients and families in Franklinton and the Hilltop. Talk a little bit about what you and Lower Lights is doing here.
Sure. Thank you. My pleasure. And thank you and good evening to everyone. Lower Lights Christian Health Center has the privilege of serving the West Side and Central Ohio with comprehensive, integrated, whole-person primary care. So what that means is medical care, as you would expect, OBGYN services, vision services, pharmacy services, dental services, spiritual care services, and then we also connect patients and families with resources as well as insurance eligibility. And we've been doing that for the last 16 years here in Columbus, and look forward to doing that for many more years. One of our newer ventures is a nonprofit grocery store in Franklinton, and we're about 60 days from that opening, and we're super excited. It's Jubilee Cafe and Market, and it will serve all comers, making affordable food and healthy food more accessible to our patients and our community.
That's wonderful. You know, so many challenges with access to fresh fruits and vegetables in different parts of our city labeled as food deserts, and so having that new affordable, fresh alternative right here on the west side is going to be a great addition.
Thank you. We're very excited, and we're really excited to see how it impacts our health outcomes and the overall health care that we're providing.
That's right. So, Dr. Laura, probably none of us see in a more direct way than you about what the opioid epidemic is doing, particularly from your role as emergency physician. So, how did we get here? What are some of the realities, misconceptions about this brain disease, you know, and how can we, you know, to Sean's point and others, how do we as a community remove the stigma, talk differently about this as a disease, and help our neighbors that are struggling?
Well, I think it's important to understand is that opiates affects everyone, and it used to be an issue that was only related to the poor or to low-income populations or to people who were unemployed or people who didn't have any education. But now it's transitioning, and it's now affecting our entire society. It's on the east side of Columbus, it's on the west side of Columbus, and extends all the way to Powell and Dublin. So as an ER physician, you know, I'm on the front line of this every single day. It's not uncommon to have 2 or 3 overdoses a day during a 10-hour shift. And one thing that I'm seeing in the emergency department is that these are teenagers, these are elderly patients. I've had an overdose of an 80-year-old person that has been addicted to narcotics. So it extends the whole spectrum, and it definitely has changed over time in terms of the population that you're dealing with. I believe it started with prescription drugs. So typically what happens is you have a patient that had surgery or a patient that had some acute pain or a chronic illness, and they get started on pain medication. So it starts off as a prescription from a physician. Over time, that transitions to an addiction, and from there, they then transition over to heroin once those resources run out. Now that's just one scenario. So that's typically how it starts. Usually, if you ask, and some of the studies have shown that greater than 80% of heroin addicts started with a prescription from a physician, and they just transition over time. Just to put this in perspective in terms of numbers, every 2 hours and 11 minutes, a person in Ohio will die of an overdose. That is about 11 patients per day. So if you think about it, we're all affected in this room. It doesn't matter where you live, what your background is, where you came from. You either know someone or someone in your family or a friend has been affected by this.
So I know everybody up here deals with or has been impacted by the opioid epidemic, the crisis, you know, whether it's destabilizing families and neighborhoods, having a negative impact on families, violence that impact negative outcomes for pregnancies, for treatment. Talk a little bit about what you're doing and, you know, where you see some opportunities for us as a community. I think the governor and others have shown some great leadership around prescribing and other things, but, you know, is it, you know, the Opiate Action Plan, additional treatment? I know Mary Haven just opened up a new center on the south side. Talk a little bit about the things that you're interacting. Maybe we start with Sean.
The new stabilization center, I mean, I don't think anyone was prepared for this. We get it all the time. The opiate epidemic has been around for a long time. And one of the things that's sad for us, and it may be sad for you, is it took a story on 60 Minutes hitting the suburbs, and now it's an epidemic. And so Mary Haven, we couldn't we couldn't treat everyone that was coming to us. And it was the saddest thing, as the doctor talked about. I like to tell people to close your eyes in this room and then open them up, and everybody in here is affected by it. I had a guy from Connecticut, we were trying to lease space on the south side, and he said, well, what do these people look like? Well, they look like you and I, and I see it every day, and it's young and it's old, and we were turning people away. And you don't want to sound negative, but every time you turn somebody away, the chances of them coming back without dying are minimal. And that's what we're faced with every day.
Dr. Pat, what kind of impact are you seeing with moms, expecting moms, that you work with in neighborhoods that are either impacted by loved ones or that may be addicted themselves?
Well, thank you for inviting me, and thank you for asking about addiction and infant mortality. You know, we know that Columbus has a very high infant mortality, and it especially affects African American and Black families. And we know there's an opioid epidemic, and we know that we've had some difficulty changing the trajectory of our infant deaths. Some of us think that because we're trying to do so much for our moms and helping them have healthy pregnancies, and we're not making as much progress, maybe it's the opioid epidemic. How is that affecting our infant mortality? Interestingly enough, it has a direct impact on high crime, and that affects infant mortality. We have a lot of addicted moms. Most of them are not Black. And where we have the biggest problems in our community is the high rates of our Black infants dying. So yes, it has a huge impact. Yes, we need more treatment. We need more treatment for pregnant women, but it's just a slice of the issue that we have here in terms of our infant mortality issues.
I think that Jay and Al, you work with and see families and kids every day that are impacted by this. What are our kids and families sharing with us, and is there insight into other unmet needs for children and families that are being impacted by this?
Well, I think we're all impacted by the crime rate that is it's probably more than 75% related directly to the opioid epidemic. If you see a prostitute, there's going to be a drug house nearby. If your car gets broken into, you can bet that they're using whatever they stole to go buy drugs. This affects the families because it doesn't take but just one drug house on the street to bring down the entire street or even in the neighborhood. The activities that go on there, again, the prostitution and the theft and the people not working, just the code enforcement issues, that all affects the families and affects the kids. They can't go out and play. If they do, they don't feel safe. The parents don't feel safe with their kids out there. And it all relates right back to the opioid epidemic.
Al, what are you hearing from kids and families you work with at the Y?
No, thank you. I would echo what Jay said, but I think, you know, at our level, at a basic level, when the needs aren't being met, you know, we're not seeing them reaching their full potential in school. You know, we run after school programs and sites, and when that stress and that trauma is there, it's hard for a child to concentrate and you know, get good grades, you know, to pay attention in class, to feel safe, to want to participate in other activities, to be their best self they can be when they're dealing with basic, you know, survival skills really and needs that aren't being met. So I think it manifests in many different ways with the kids we see. Some have behaviors they act out, some have anger issues, some get into depression, you know, so I think it affects all of them in different ways, but the bottom line, I think, is they're not able to reach their full potential, especially academically. We're in the middle of a school year, getting ready to end. I think that's the number one thing is, you know, as for any of us, I think it'd be hard to focus if you were dealing with these type of issues.
Dr. Dana, for those that are watching or that are here tonight, what should folks do if they're aware or if they suspect someone close to them is abusing opioids, and what's Lower Lights doing to help with the opioid disorder, and the impact it's having on the West Side?
Sure. So to answer the first part of the question, I think talk. The more we talk and the more when we're concerned about somebody we love, we bring it out of the darkness and into the light, and we destigmatize, as has already been mentioned. This is affecting all of us, and what addiction does is it isolates. And so if we can break the isolation and talk to our family, our friends, seek help, I think those are all the first steps. I would also put a plug into, if you're really concerned, making sure you have Narcan available, because it is saving lives. At Lower Lights, what we've been able to do over the last year, and it has been one of the hardest and at times difficult things we've done as an organization, but also on the flip side, the most joyful and rewarding things that we have done is we have integrated a medication-assisted treatment program into our primary care, and we're doing it from an office-based approach. So I'm a provider, and I see patients for diabetes and medical things right alongside some of the opiate use disorder patients. Sometimes I'm seeing the same patient for their Suboxone and treating their diabetes all in the same visit. And we feel like that is a way to help people have access to treatment in a place they're already comfortable with, because they're coming to us for primary care reasons, and it allows us to more comprehensively treat that addiction. And so we have about 95 patients we've treated this last year, and we're hoping to have capacity to double that this next year.
That's great. Dr. Laura, talk to us a little bit about what you and Ohio Health are doing in leading the way on this, helping us to further implement the Opioid Action Plan.
So at Ohio Health, the opioid crisis is one of our main priorities, and we have an opiate task force just within our organization that's centered on organizing all of our initiatives. So just to give you a couple of examples, one of the things that we're doing is a pilot program through our emergency department. So when we have patients that come in our emergency department after an overdose, we take that opportunity to educate and to intervene. With this patient population, it's very important that you act in that moment, because you may never have that opportunity again. So when they come in, our pilot is that we are giving them intranasal naloxone. For those that don't know, it's a medication that reverses the effects of opioids. We're educating the patient and their family. So if you have a family that is there, they could potentially save that patient's life by giving them this medication after an overdose. We also work very closely with the REACT team, which is in conjunction with Southeast Mental Health, and also with the Columbus Division of Fire. And what they're doing is they're actually going to the scene of opiate overdoses, and they're actually talking to these patients. They'll come into the emergency department as well. And again, taking that moment to intervene, to offer resources, to give them information about substance abuse, and to see if we can impact someone's life or change that direction. On a greater scale, we're looking at increasing the amount of physicians that are specialized in addiction medicine. A lot of times, there's just not enough of us to do the education and to see these patients on an outpatient basis. So we're looking into developing a fellowship program to train more physicians in that area. On a personal note, as an ER physician, we're the ones writing the prescriptions, right? So we're being very mindful of what we're doing. When I have patients come in with acute pain, do they really need a narcotic prescription? We're rethinking that. Can we treat them with something that, such as an anti-inflammatory or Tylenol, or try some alternative measures like physical therapy or massage, and look into other things that maybe can treat pain versus just resorting to narcotics? So at Ohio Health, we're doing a comprehensive approach, if you will, trying to use our mobile units to do community outreach as well. And the list goes on. There's a lot of work to be done.
Yeah. Well, Sean, so, City Attorney Klein oftentimes talk about the need. I don't think a lot of folks understand how long this disease can impact the brain, that this isn't we've never seen anything like this before. I mean, not with any other type of substance abuse that we've ever seen before, that literally it changes the chemistry of the brain for years, and recovery can take a much longer period of time than we've ever seen with anything else we face. So what's next? Is it additional stabilization centers? The Opioid Action Plan, I know, was funded by Adam H., the city, the county, state, all came together, the federal government, to help make that work. What's next for Maryhaven and for implementation around the plan?
Well, we've already, so on January 19th, we opened the Stabilization Center on South High Street. I can tell you today that we're almost full. And we knew that. And so I think moving forward, we have to look at more stabilization centers that can provide treatment. There's a misconception out there, okay, Sean, you're opening up a stabilization center, you're actually going to reduce the opiate overdoses. That's not what we're talking about. Those are still, unfortunately, going to continue to happen. We need to be a landing spot for these folks when they do overdose. You talked about REACT. It's a great program. They've actually put workers into hospitals that know what addiction looks like, knows what services are about. And so you talk about the Opioid Action Plan. For the first time, I think, in Columbus, and we live in a great community, and I'm not just saying that because the mayor's here. This is an awesome community. For the first time, I feel like we've done something other than put a task force together, or we put a committee together to talk about stuff. This stabilization center is a direct result of people getting together from educational, hospital, and financial resources to actually provide something that comes out of a task plan. So I'm really, really excited about this. We need more. We need more treatment beds. I think everyone knows that. But we're well on our way, and we just really want to say thank you to the city, to the governor's office, to all the dollars that we have, because it does take money, and that's the thing that no one wants to talk about. It takes money, and so really, really excited about the future.
So to your point, what's this look like for folks maybe that don't know as much about the rehabilitation and treatment trajectory, the timeline associated? How long would somebody stay in the stabilization center, and then how long do they need ongoing treatment to have the best shot at beating this addiction?
We like to say that it takes as long as the patient needs, but when you come to the stabilization center, we're going to really be committed with you anywhere from 6 to 12 months. So it's going to at least take 6 to 12 months. A lot of it is ridding you from the environment in which you came from. It's changing friends. Sometimes it's unfortunate, it's changing family members, getting away from these folks. For about 6 to 12 months, you're with us. And then I would say another year to 2 years with a lot of community support and a lot of agencies, hospitals and community partners that we have in here tonight that will absolutely not give up on these folks, because they're going to fail. They're like us. We all fail. We fall down. But we've got to be there to catch them when they fall. But it's at least a 1 to 2 year process, at least.
It's just, I mean, it's so different than anything else that we've ever faced. So it's just important for us to talk about that with this impact of so many folks in the neighborhood. Dr. Dana, Dr. Laura, what else do you see missing from our community's response, our implementation of the Opioid Action Plan? What else should we be thinking about and contemplating?
I just think that capacity is one of the biggest variables to still figure out as a community, because while our program has treated a certain number of folks, and the stabilization center, which just opened, is almost full, that's kind of the recurring theme. And certain folks need different levels of care, and so we need capacity at all levels of care that is increased over what it even is currently.
Any sense of where we're at, how many beds and spots are offered as a community, and what the need is out there, just to give some perspective to folks?
So at Maryhaven right now, with the addition of the 55, we're at about, we're at about 100 beds. And so at Stabilization Center, we're almost full. At Alum Creek, which our location has been there since 1953, is full. And so, that's our capacity, along with the outpatient stuff, but we have 100 beds offer.
I guess to your point earlier, Dr. Laura, thinking of the additional professionals, medical professionals, and trained physicians to deal with this, as well as treatment centers. It's got to be a big priority moving forward.
Absolutely. I think, when you're formally trained in something, I think you're that better of a teacher and an educator. So that's what one of the initiatives we're trying to do is find physicians and train them specifically in addiction medicine, because it's different from any other specialty. You know how to talk to these patients, you know what triggers them, and I think they'll get better, more reliable care that way.
Dr. Pat, I talk a little bit about, as we make this transition to talk about infant mortality, talk about how the social determinants of health, including addiction, violence, crime, family instability, those social determinants, how they contribute to higher infant mortality rates.
So, well, thank you. And I did want to give a shout out to Sean, because at our OSU East Moms to Be site, every week we have caretakers from Maryhaven drive a van with the moms who are pregnant that are in recovery, that are living at Maryhaven. They stay there for the 2-hour session, and that's, our Moms to Be is a teaching program, a support program, and we're located in all 8 of the CelebrateOne neighborhoods. I wanted to give a shout out to CelebrateOne also, because it's, like Sean said, it's the result of a task force of multiple different engaged pillars of our society here in Columbus getting together and saying, this is immoral that we have such disparities, that we have 2 or 3 times more black babies die as white babies, and we are, as a community, are not going to allow that to happen. And so CelebrateOne, as you know, came about because of that task force. I have to say also the mayor came to a Moms to Be. One of our very first sites was in Wineland Park. You came in 2012, I think. We've been in the community since 2010, specifically to address housing, food insecurity, transportation, stress from domestic home situations, and the high crimes in the neighborhood. So those are the social determinants that have a huge impact on the pregnancies of our moms, and really contribute just as much as our medical issues to our high disparities. So, I could talk all night about, the social determinants, about Moms to Be, but I know there are other questions that you may have, Mayor.
So, Dr. Dana, because you all are on the front line in working in partnership with CelebrateOne and Moms to Be and all the other groups in the organization, anything particularly in Franklinton and the Hilltop, obviously those major drivers, the social determinants of health, things that we've talked about here tonight, what else are you seeing that's impacting the higher infant mortality rates on the west side?
Sure. We see, along with the social determinants, I would echo that's as important as what I'm just getting ready to say, but access to prenatal care and having that access early and often. So having early access and then consistently having that care during pregnancy is a big issue. At times, I think there is a disjointedness to who provides the care versus who delivers the baby versus who may be seeing the mom and or the baby in follow-up. And so some of that continuity creates a potential for increased bad occurrences. So those would be the biggest things that we're seeing.
So Al, you aren't a healthcare provider, you're not a doctor, but the Y has an important role to play in the CelebrateOne effort. So talk a little bit about why, what the Y is working on and how they're engaging around the CelebrateOne work.
Sure. I think, behind the leadership of CelebrateOne, just their unique ability to bring partners together, as people have talked about, but also the dedicated hours that the community connectors work. In our Y world, we wear a lot of hats and we try to do a lot of things, but having specific people whose task it is specifically to go out and serve the community, their sole focus to connect people to resources is huge. And I think that's, the role that the Y can play and being a safe place for people. Everybody knows the Y, right? So it's a safe place where you can come, and we might not have the answer, but if we have connectors that can get people the answers, get them the right information, get them to the right resources, we think we're doing our little part.
Yeah, I think it's so important for us to remind and reinforce that our infant mortality rates are not what they are because we have, it's not just a healthcare issue. There's so much more at play and contributors to infant mortality. So Dr. Pat, when I visited that Moms-to-Be back in Wyland Park, it was a neighborhood with much higher infant mortality rates than most neighborhoods in the community. It is now not, very proudly, a CelebrateOne neighborhood because of Moms-to-Be and the great work done there. You mentioned how you're working with other neighborhoods throughout the city, including Franklinton and the Hilltop, the South Side, Linden, and all 8 of our CelebrateOne neighborhoods. How'd you do it in Wyland Park? How did you do it in Wyland Park? And how can the community get engaged with Moms-to-Be's work in these other neighborhoods?
Well, I mean, Wyland Park is just a fabulous success story. And, you know, when we started in 2010, there was high crime, as Mayor Ginther mentions. The infant mortality was almost 20 per thousand. Most of the babies that died were black babies, and 2 died per year. About 100 babies were born, 2 died per year. We went there because we wanted to learn from the moms. Why was there such high rates of infants dying? What were the underlying causes? We had a huge partnership with the Columbus Public Health, with the Wyland Park Collaborative, with the investors that had gone into the neighborhood to turn it around, Campus Partners, Kroger's, Wagenbrenner, Chase. So it really did take more than a village. It took leaders in the community that said, this is not proper, this is not right, this does not reflect who Columbus is. So that investment, and I think it's been $50 million, it's probably more, but that investment by strong leaders to say, we are going to have safe housing, we're going to get rid of the Short North Posse. I hope none are here. Okay, sorry. I want to go home safely tonight. Sorry. Oh, I've got a bodyguard here. Okay, you know, because, okay, you know, our moms, just one example. Once a mom, 8-month pregnant, came in. She said, is this putting my baby at risk? I had to lay flat on my stomach during the police raid. These moms are under incredible stress, and I mean, that reflects what's going on now with our opioid crime rate. Mm-hmm. So, yes, it took everyone. We feel like we did our part with Moms-to-Be because we had weekly 2-hour sessions there. We had nurses, doctors, social workers. My comrade, Twinkle Schottke, who said, teach CPR, be consistent, be reliable, be persistent. That's what the neighborhood needs, CPR. Mm-hmm. You know, we're there every Wednesday. We're still there every Wednesday, even though our infant mortality is less than 3 per thousand. And that's what we want for every neighborhood, all 8 of our CelebrateOne neighborhoods, and we can do it. This city has the leadership, has the motivation, and has the heart. And thank you, Rod Shane. I was so excited when I saw on television that you are giving your $2,000 win to CelebrateOne. Mm-hmm. So.
Yeah. So we've talked a lot about what we're collectively doing together, but you know, I'd like to pose a question maybe to Dr. Lauren, Dr. Dana, about what's the role of public health, Columbus Public Health and the public health world in addressing these issues of infant mortality and opioid addiction. From your perspective, what should public health be doing to support this work?
Well, I think it's important to take our services to the community, to where people live. You know, it's really difficult to expect patients to just come to our hospitals or come to our clinics. Instead, we have to take our services to their communities. They have to be able to walk out of their door, walk down the street, around the corner, and be able to have services available to them. We found that several patients in Columbus, I mean, it's more of a global issue, but are utilizing the emergency departments for primary care services. I see that very frequently. So what we've been doing is, through Ohio Health, we've been sending mobile units. We have one that's at the Hilltop that works with the YMCA. And we go to that community, we provide primary care services, we provide wellness checks, we help manage chronic illnesses, hypertension, diabetes, and we take it to their community. Another thing we focus on is substance abuse. We have a social worker that's available to provide resources to help families with food insecurity and employment issues. So it's more of a well-rounded approach to the families. We also have our mobile unit that focus on women's health, and Sana Booker is here tonight. And what we do with that is we're focusing on the infant mortality as well, is following that patient through her pregnancy, making sure she has prenatal care, making sure her entire family is cared for. So I think that's from a public health standpoint, we have to take our services to the communities where people need them.
Dr. Dana?
Sure. From a Columbus Public Health standpoint, they have been a tremendous partner for us and for, I think, all of us who provide health care in this community. I think they have done a good job of raising awareness about issues, about convening people to talk about solutions, and then helping us continue to march forward towards those. So I think in the areas we've talked about tonight, I would see their role doing more of what they're doing and helping us to continue as a community and as healthcare providers in the community to be on the same page, working towards the same goals with initiative and intent.
So we launched last fall based on roundtables that some of you participated in around the community with law enforcement, Safe Director, and others, this comprehensive neighborhood safety strategy that really focuses on dealing with the spike in homicides and violence in our neighborhoods in a much more comprehensive way. So I guess for anybody, and feel free to jump in, how can we address violent crime through a public health lens? We've made it abundantly clear we cannot police our way out of the homicide spike and the violence we're seeing. So through a public health lens, how does this comprehensive neighborhood safety strategy help us realize our goals?
I would re-echo what I just said. The public health lens lends itself to solving that problem in the same way that we solve health problems, with increased education awareness and in convening collaborators and partners to work strategically together towards a solution for safety and crime as well.
Dr. Pat?
Well, I'd just like to go back to Wineland Park because, the crime rate did go down there considerably. But one of the important things that we've shown in Wineland Park is that the kindergarten readiness of our children in Wineland Park is one of the highest in Columbus. 71% of the kindergartners this year were ready for kindergarten. And we attribute that back to the interventions we do. We do 2 hours of developmentally appropriate play every week for our babies and children, older children. So when we tie, it's not going to solve all the problems, but our babies need to know they're loved, that they're ready for school, that they have a supportive environment in the neighborhood, and that they don't have to go to drugs or sell pills to make a living, that there is a pathway to them to be a productive member of society. So I think it starts with a healthy pregnancy, and then you get the healthy baby, and then you get that baby's ready to learn. And we've shown that in Wineland Park, and we can do that in all these neighborhoods.
Sean, Dr. Laura, any other thoughts through the public health lens?
I think Bishop said it best. You turn on the radio, you listen to the news, you read the newspaper, you somewhat become depressed with our crime and our talk in Washington, D.C. Mayor, I want to say thank you for having conversations. Conversations like this, people showing up on a Tuesday night to fill a gym in February, shows that we live in a community that cares. And I think if we continue to have conversations like this, I think it'll get better. And I just want to say thank you, Bishop, for allowing me not to be depressed for 5 minutes. We have become a society and a nation that doesn't talk, and therefore we don't listen. And so just wanted to say thank you to both of you.
Well, and I think there's some great success stories that have been shared here tonight. The Stabilization Center, some of the great work Al and his colleagues are doing at the Y, and the work that's been started by Dr. Laura at Ohio Health, is in the expansion of the work that's being done at Ohio Health. But Dr. Laura, any final thoughts on the public health lens and community safety?
I just think we need to be collaborative. I think that we all need to sit at the table, roll up our sleeves, and all come up with a plan to address some of these things. Regardless if you're Ohio Health, Ohio State, Mount Carmel, the city, each community, we need to all collaborate and just talk about the things that affects each of our communities and come up with solutions that we can all implement to make a change.
Great. Al, share some of the success stories. What are some things that you're doing with the Y that you're seeing some progress and offer some hope to the work that we're engaged in?
Well, first, I can't take the credit. I have an amazing team, and again, I would say our connectors through the YMCA, I know they served over 3,000 clients this past year, so I think that's amazing. Those are people that are ready, that are equipped, to your point, know about the A, B's, and C's of safe sleep. They've talked and shared, resources with thousands of more, so getting that word out far and wide, I think it's the rising tide theory, makes light work for everybody. The many hands makes light work for everybody. I think also with CelebrateOne, they really, when they convene us in groups, they have us think outside the box of not just being reactive to what's going on, but how do we get further upstream and look at preventative solutions and some of the other systematic issues that are causing this. I remember one of our very first meetings, Dr. Clark showed us it's like an iceberg. You just see the very tip with infant mortality, but then there's all these things under it that we have to address. And again, I would just echo what she said down there. Collaboration really has been key for us in working with other partners in the community.
So Jay, neighborhoods are the heartbeat of any city. Their neighborhoods of this great city are what makes us special and unique. Those neighborhoods are made up of pretty amazing people. So before I start taking questions, what do you want the audience, those that are here tonight and maybe viewing via live stream, to know about the people of this community, of this neighborhood?
The Hilltop is made up of all different types of demographics, from young starter families to the elderly and everything in between. I think one thing we all have in common, though, is that people that live in the Hilltop, we're the working class. We're the ones that get up and go to work in the morning. We're the ones that your auto mechanics, your plumbers, your carpenters, and we're proud of what we do. We're proud of our community, and it's coming back. It took 40 years to go downhill. It's probably going to take hopefully half that to come back. But
I have no doubt you're going to make sure that I get it done in under half that, right?
The citizens here, though, are working hard. There are so many different groups that are working in the Hilltop. The Greater Hilltop Area Commission, we helped to put some of those together, but we can't take the credit. But the Hilltop's coming back. We're hardworking citizens, and we're coming back.
Thank you, Jay. So a couple of questions here. One from Austin Hill around opiate addiction. I'm going to probably start with you, Sean, and others can chime in as well. And it may be something we have to go to Adam H. for some more information, or Dr. Roberts might be able to. But how can residential recovery organizations collaborate with the Franklin County Opiate Action Plan to build momentum towards a lasting solution. So what's the role of residential recovery organizations within the recovery work?
I think the immediate role is to get immediate access to treatment as quickly as possible, as Doctor talked about. Each time that these people leave the facility, you have now lost an opportunity to get them clean. And so how the residential component acts or interacts with that is to gain immediate access to treatment initially, and then have long-term residential treatment to remain with these clients to make sure that they actually beat this disease.
We have a question here from Jillian Olinger via Facebook. To Al's point of children not being able to succeed in school when dealing with the traumas of addiction in the home or community, are there resources, counselors for children being made available in school and after school to help children navigate and process these stressors? What type of services do you offer at the Y for children and families who are dealing with this?
Yeah, I think one of the things for collaboration that we do is, I know at some of our Ys we're working with the mental health professionals to bring them in to do observations when we have kids that maybe we see that maybe have some behavior issues, and then they can refer them on to additional services. I know just because of where our Y sits, we've worked with counselors at the elementary schools and the middle schools. When we have issues, we'll call them, they'll call us, this is what's going on. So I think some of that is going on, but definitely if we could strengthen that collaboration and that spirit, and always, the reality is we are in need of more. We're in need of more, in my opinion. Mental health workers, I know a lot of the counselors are at the schools a couple of days a week, and there's a lot of kids to deal with that have issues. So I think those that are there are doing a great job, and as we continue to build momentum and can bring more people to the table, it will only have a greater impact.
Trying to get to as many of these questions as we can, but jump in if you want to add anything to these questions. What are some of the reasons people are turning to opioids? Is there anything that can be done to reduce the number of people turning to drugs, ways to prevent addiction in addition to treating it and through recovery?
I think one of the reasons why they're turning to opioids is pain. Chronic pain is a major issue for a lot of people. And then when you start down that pathway of managing pain with narcotics, then it just snowballs from there. So I think we have to go back to the beginning and start thinking about how we manage pain from a more global level and picture, and look into alternative methods, try new things, do more research around managing pain. So I think we just have to go back to the beginning before it starts to become a problem.
I would add one
Please,
step.
Dana. Yeah.
I would add one step even prior to that is helping us reset kind of our expectation as a culture and a society that, having some degree of pain is a normal kind of part of being human and life, and like having an expectation all the time. When I see patients, their expectation is, I don't want to have any pain. Well, sometimes we can't get rid of the pain, and sometimes the pain is there for a valid reason, and we need to not be shooting for no pain. We need to be shooting for management of that, or amelioration or lessening of it.
If I can just add, Mayor, that I think the other aspect that we need to pay greater attention to is prevention. We need to be camping out at YMCAs and the Ys and the Boys and Girls Clubs and schools, talking to kids about the effects of drugs and alcohol. It's not the DARE program. It's much more in depth than that. We need to educate these kids and show them real life examples of what can happen with your life. So greater need for prevention. And I think sometimes that's where we're falling down.
Jay, I think you wanted to chime in.
Yeah, Sean mentioned prevention. I think a big part of it too, at least for young people, is a breakdown of the family unit. Kids will turn to drugs or gangs looking for ways to fit in.
Something to belong to.
Yeah, and they won't find the right ways unless there's a good family backing them up.
I just wanted to say, too, I think it's important to talk to our children and educate our communities. And, studies have been shown that If a child is talked to about drugs by a parent or a trusted adult, that they're 50% less likely to abuse drugs. So we need to get into the schools, we need to talk to our children, we need to talk to their friends, and just do more direct outreach to the next generation.
So a question, and I think this is also a challenge to us, Sean, all of us. So I guess two things, and maybe our medical professionals can offer some insight too. When a patient survives an overdose, what immediate interventions and treatment is provided to avoid another overdose? Maybe what is available and what should be done. And then to Drew Bagley's question here, when will there be a stabilization center on the west side to address the opiate problem? I think we clearly understand where Drew's coming from.
Sure. Well, the good news is we've already started to strategically think about where we put the next stabilization center. And if you look in Columbus, the two major zip codes is 43207, which is on the south side, where all the overdoses are happening, and then the second most are on the west side.
Yeah.
And so it just makes sense to the doctor's point earlier, access to treatment is really key. And if you don't have to go far or take 3 buses to get there, I think the success rates are better. I think the stabilization center on what happens now, and I think this is attributed to the great work that the action plan created. When a person was saved by naloxone about a month ago, they went to the emergency room. The emergency room tried to treat them, and they said they wouldn't want treated or they didn't want it, and they left the emergency room. You've seen case by case on the news. That client then went out in the parking lot and overdosed again. So now what we do is when they hit the hospital, those REACT workers, they transport them to the stabilization center, and immediate treatment begins the minute they hit the door. And we've got workers in there, a lot of times there are advocates that are there with them that have also are conquering the disease, that are talking to them about the treatment and the services that are available to them to make them more likely to succeed.
You raise an important point that we haven't talked about tonight, and that is the amount of folks that are first responders, our police officers and firefighters, how much naloxone they have administered, how many lives they have saved. Sometimes, though, it's the same folks over and over and over again, and then those police officers and firefighters aren't responding to other calls for service in our community as quickly as they could otherwise, based on the resources that are available. And so really, as Klein always talks about, going from saving lives to changing lives, to have those first responders responding to calls for service and not addiction and public health issues.
Yeah.
Dr. Laura, anything?
Yeah, when you were speaking, I was thinking about the fact that there have been shifts where I had a patient come in as an opiate overdose in the morning, and the same patient came in 6 hours later as a second opiate overdose in the afternoon. So the EMS, the first responders are amazing. They react quickly. They know exactly what to do. Sometimes patients can be agitated or not want to come to the emergency department, and they definitely play a great role in speaking to them and getting them exactly where they need and the resources that will help them. So I can't thank the first responders enough for what they do to get the patients to us so that we can give them the resources. It just makes all the difference in the world.
I should say a word about the pregnant woman. We also need more access for the medical treatment to allow them to withdraw or to be treated, not withdraw, so that baby is not at risk. And we do need much more access for the pregnant, addicted mother, because sometimes that is the sentinel event that turns her around towards more long-term being drug-free, because she's got a baby and she wants to nurse and raise it productively.
I've got 2 more questions and I think 3 minutes. So we'll go rapid response here, and I'll go to Jay first. I think Sean talked a little bit about this, but this is from David Sawyer. Is there a hotspot geographical area for the opiate overdose emergency on the Hilltop and west side of Columbus. And I think you said '07, Sean, on the south side, and then what was the other zip on the west side?
It's can't remember the zip, but it's definitely right here.
In the middle of the Hilltop?
Yeah.
Are there parts of the Hilltop that you think have been disproportionately impacted?
Yeah, there's at least two that come to mind. The Sullivan Avenue corridor used to be limited to far west or far east of Hague Avenue, and it has worked its way all the way to Georgesville Road, and that is absolutely one of the main corridors. Also, I believe the Wedgwood community is highly impacted by the opioid crisis. Not necessarily the people that live there, but there are people that are preying on the people that live there, and those are the ones selling the drugs. And so, yeah, I would put those two at the top of the list.
And a final question from Nathaniel Jordan, I'll pose to both Al and Dr. Pat. We've talked a lot about reducing infant mortality and the interaction, the intervention, and the work we're doing with women. What are we doing with men? What are we doing with the dads? And how can they contribute to reducing infant mortality rates?
Well, I'm so glad you asked that question because, we've had moms to be for 10 years almost. And for the first 8 years, we tried to get a good dads program because they are key. If we could get every dad involved with every pregnant mom, we would have much healthier babies and outcomes. They'd help with the rent, they'd help take the mom to get her groceries, to get her laundry done. They would give emotional support. So the more we can do to tell these men how valuable they are, the better outcomes we'll have. And we have a great partnership now with the Urban League and Action for Children, and we have a dads program at Moms to Be. We've had almost several hundred dads involved. So you are so right. It is essential.
Al?
Get dads involved.
Al?
I would just echo that. I think working with fatherhood initiative programs so that they're understanding. We find that a lot of them maybe didn't have a father growing up in their own home, so it's not something that is coming natural to them. So giving them those resources through the groups, again, collaborative spirit through the groups that are doing fatherhood initiatives is important and key. And what we see at least is a lot of them want to be active, they want to be involved, they want to be a part. It's just giving them the tools to know how to do that successfully.
Will you join me in helping to thank our panelists for their participation here tonight? So I'm going to thank them for participating and being so great at partnering with us in neighborhoods throughout the city, not just on the west side, but in particular here. For more information about CelebrateOne and Columbus Public Health, there is a resource table out in the lobby. Our next neighborhood conversation is next Wednesday, February 21st at the Linden Recreation Center. We'll be covering two more important topics there, the work of recreation and parks and education in continuing to build strong neighborhoods. Tonight we do have some special guests from the Hilltop who have been important in our efforts in high-quality early childhood education. Would those of you from the Greater Hilltop Pre-K Education Task Force stand up so we can recognize you? Thank you. Thank you, Lisa. That important work is going to help us double the number of young people on the Hilltop to attend high-quality pre-K by 2020, and your plan and your work is outstanding. We are grateful for everyone that submitted questions. If there are any others online or here tonight, please make sure we get them with contact information that we can follow up with. And now for our final benediction, it is now my pleasure to introduce Pastor Mike Portefeuille.
I was called into the full-time ministry after having served as the director of Worcester Healthy Start Initiative, which was like CelebrateOne, responsible for infant mortality in the state of Massachusetts. And one of the challenges we faced was community integration or community participation, which in effect leads to sustainability of the programs. But when I visited the office of CelebrateOne, I was very impressed with the way this program is heavily integrated into the community, and I believe it speaks to sustainability of the program even when funds are running short. I celebrate CelebrateOne. On that note, I'd like to say a short prayer for all of us as we get ready to go. Gracious God, we thank you for this moment. Thank you for a beautiful city like this. Thank you for governmental structures, leadership, and all the social, economic, and educational institutions that are working seamlessly to ensure that this city is a tolerant city, a place open for all to come and have great families, great education, and a great destiny. We thank you for the leadership, outstanding leadership of our mayor and all of the leaders that are working with him around the clock. Thank you for the unquestionable commitment to ensuring that this city is free from the challenge of infant mortality and drug overdose. Thank you for the amazing results that we are already seeing, oh God. We have every confidence that you who have begun a good work in this city, you will bring it to an ultimate end. Lord, we pray for families that have lost their babies in the first year, families that have lost loved ones to drug overdose. We pray that you will comfort. We pray you will strengthen. We pray you would uphold. You are our sustainer. You are our restorer. Restore, strengthen, and hold this community and all the families together. And above all, we ask, oh God, that Jesus, may your light shine in this city. For if your light shines, the darkness of infant mortality and Lord drug overdose will be dealt with. Let your light shine in the community, and let us see that, Lord, you are reigning in our midst and you are ruling in the affairs of men. Thank you for the community conversations. Thank you for the wonderful dialogue that is going on, and for all the wisdom that we are learning and gleaning and implementing together. Continue to be with us. And now we pray that your grace will be our portion, even now and forevermore. Amen.
This concludes our program. Thank you for attending the 2018 State of Our City Neighborhood Conversation.